السلام عليكم طلاب صف خامس، إن شاء الله تكونون بخير. اليوم محاضرتنا عن Refractive Errors، وياكم دكتورة هند أحمد. Starting with some notes about the optical systems of the eye, which has camera-like features. The focusing elements of the eye are the cornea and the crystalline lens. The diaphragm is the iris, and the film is the retina. The cornea contributes to two-thirds of refractive power of the eye. The cornea refractive power is 43 diopters, while the crystalline lens is 18 diopters. The retina contains the highly sensitive rods for registering images at very low levels of illumination, while the color-sensitive cones are used for high resolution at high level of illumination. The non-accommodating emmetropic eye brings any pencil of parallel light rays from an object more than 6 meters away to focus at the plane of the retina. An emmetropic normal eye will have a clear image of a distant object without any internal adjustment of its optics. Most emmetropic eyes are 24 mm in length. In myopia, the myopic person sees a blurred distant vision, which is clear for you in this picture. The myopic eye brings parallel rays of light to focus in front of the plane of the retina, which causes a blurred image. Types of myopia include: number 1, axial type. The antero-posterior diameter of the eye is longer than normal in this type. Number 2, curvature type, in which the cornea is steeper, which means more curved, than normal. This type is more common than the axial type. Number 3, lenticular type, is caused by changes in the crystalline lens, such as increased curvature or increased refractive index. Clinical classification. Simple stationary myopia, less than 6 diopter, develops after the age of 4 years. Stationary, which means stop before 20 years. It is normal physiological process and can be corrected. While pathological progressive myopia, more than 6 diopters, develops before the age of 4 years. It progresses even after age of 20 years. It is a real pathological process. These children usually have a large eye globe. An eye with refractive error of 6 diopters of myopia are called high myopia. This eye is predisposed to vitreoretinal degeneration, for example, retinal holes. Clinical course in myopia is rarely present at birth, but often begin to develop as the child grows. It is usually detected during school age and increases during the years of growth spurt until stabilizing around the mid or late teens. Symptoms include blurred vision at distance. Myopia is corrected by concave spectacles. Hyperopic patient see blurred near vision, as you see in this picture, in contrast to myopic patient. Hyperopia. The hyperopic eye brings the parallel rays of light to focus at a point behind the retina, causing an unclear image. Hyperopic person usually have difficulty in near vision, but there may be a problem in seeing clearly at distance, also especially when getting older. Near vision always blurred more than distant vision. Most children are born with mild hyperopia, which is physiological, due to the small size of the eye, but this usually resolves in the second decade of the life. Types of hyperopia include axial hyperopia, in which anterior-posterior diameter of the eye is shorter than normal. Second, curvature hyperopia, in which the cornea or the crystalline lens is less curved than normal. Symptoms. Number 1, there is asthenopia, which means uncomfortable vision, which often occur after prolonged time spent in near work or reading. Number 2, frontal headache. Number 3, blurred distant vision. And lastly, early presbyopia. Hyperopia is corrected by convex spectacles. Astigmatism. There is a variation of the corneal curvature in different meridians. Light rays passing through a steep meridian are bent more than those passing through flatter meridian, and this results in blurred image. If the vertical corneal meridian is steeper, the astigmatism is called withdrawal astigmatism. But if the horizontal meridian is steeper, it is called against the rule astigmatism. Astigmatism can be myopic or hyperopic, since it is merely the variation between the curvature of different corneal meridians. Symptoms. Blurred vision, asthenopia. Correction of astigmatism is achieved by use of cylindrical lenses which have power in one axis and no power in other axis. In this picture we can see different meridian. The red meridian looks to be flatter, while the blue meridian looks more curved. In this case we will have an astigmatism with hyperopic and myopic features. Accommodation is the process in which the crystalline lens increases its power when focusing at near objects. Mechanism. The lens is suspended in the eye by the zonules that are attached at one end to the lens capsule and at the other end to the ciliary body. During accommodation, the ciliary muscles contracts, leading to relaxation of zonules, and this reduces the tension on the capsule, on the lens capsule, leading to a more convex shape of the lens, therefore increasing its power. We can illustrate this process in this diagram. The superior image shows us how the crystalline lens, when focused a distant object, how the light rays can reach at the retina to focus it clearly, and this is the structure of the lens. In accommodating eye when viewing a near object, we can compare the lens structure. It's more globular, more curved than in non-accommodating eye. To make these near rays of light come to focus in front, while on the retina, to focus at the retina. Presbyopia. Symptoms of presbyopia occur as a result of decreased accommodation power in patients over the age of 40 years, resulting in difficulty in near vision. The symptoms are worsened by fatigue, illness, fever, or other debilitating condition. Presbyopia is a physiological change in the lens that results in decreased in elasticity of the lens fibers and hardening of the lens. The accommodative power is maximum at childhood, but decreases with time to reach less than 4 diopters by mid-40s, causing objects nearer than 25 cm to be out of focus. Correction of presbyopia is by giving the patient convex glasses to help him in near work. Contact lenses. The contact lenses rest on the surface of the cornea, replacing the corneal curvature with a contact lens surface that is calculated to correct the refractive error of the eye. Contact lenses offer cosmetic benefits, and their small diameter and thinness may provide optical advantages in high degree of ametropia by reducing peripheral image distortion. Disadvantages of contact lenses include: number 1, they interfere with oxygenation of the cornea, and therefore their prolonged use may lead to corneal edema. They carry the risk of damage to the corneal epithelium during their wear, causing bacteria to invade the cornea, leading to keratitis. This is another illustration of the refraction of the light rays in normal eye, myopia, astigmatism, and hyperopia. Also, you can see how myopic patient, astigmatism patient, and hyperopic patient can see. In myopia, as we explain, patients see blurred distant image, while in hyperopic patient there is more blurring of near vision, while in astigmatic patient there is problem in the parallel rays of light, so it's a blurred, abnormal perceived image. Dear student, thank you for your listening. I'm ready to answer any of your questions at any time.